Hi, my name is Catherine Rebant Payne, Director of Marketing and Communications at Oakland Family Services. I'm joined by Debbie Smith, who's a director here at Oakland Family Services as well. And today we're going to be talking a little bit about children's mental health. What are we seeing amongst the children we're serving, and what are we doing to try to help children's mental health? So Debbie, what type of trauma and mental health issues are you seeing?
Well, we see a lot of intergenerational complex trauma, and what that means is that trauma occurs over many generations, and it's not one single incident, it's multiple incidents. So physical abuse, sexual abuse, neglect, exposure to domestic violence, exposure to parental substance use, those types of things.
Okay.
And then other mental health issues we see are depression, anxiety, attention deficit hyperactivity disorder, autism, and we have a few kids that have bipolar or just the first stages of schizophrenia as well.
Okay. One thing that we hear a lot about now is increased suicide rates. Mm-hmm. Can you talk about how prevalent the suicide risk is amongst the kids we serve?
Yes. Unfortunately, suicide is the second leading cause of death in kids ages 10 to 24. And that's in Michigan and across the country, and those numbers continue to go up. So we do see children here at Oakland Family Services that have daily suicidal thoughts as young as 8 and 9-year-old kids. We have kids that have suicide attempts and sometimes have to temporarily go in the hospital to keep themselves safe before they return to services with us.
So what is Oakland Family Services doing to address these issues?
Well, evidence-based practices are really important here. And what that means is that they're research-based interventions or clinical therapeutic tools that are backed by science. A really important one is trauma-focused cognitive behavioral therapy, and we have several of our clinicians trained in that.
Can you tell me a little bit more about what that is?
Sure. It is, it helps kids learn coping skills to deal with any kinds of triggers that come from their traumas. And at the same time works with the parents, so the parents learn new skills, help the parents and kids form a bond, and then the child develops a narrative that helps desensitize them.
That's great.
As they talk about the trauma.
Specifically in regard to suicide, how are we equipping our staff here to give them the right tools to interact with someone who might be contemplating suicide?
So a couple of years ago, we started a zero suicide work group that has staff members from the entire agency. One of the things that we're focusing on is training, and again, evidence-based training. So many of our staff have already been trained in Safe Talk or an assist model. One is more of a preventative measure, one is more of an intervention for suicide. And then in addition, this work group is looking at agency policies and procedures so that we're very consistent across the agency.
What are some ways that you've seen Oakland Family Services make a difference for children in your work? So what are some success stories that you can share?
Well, you talked about the suicide rate. So we've worked with a lot of kids who have regular suicidal thoughts, who have developed coping skills to be able to deal with those emotions, build better relationships maybe with their families, and eventually have hope for living. We have other kids that are able to manage their aggressive behaviors and then improve grades or behaviors in school. We even have parents that say that we've changed their lives because of the work that we've done with just the parents.
That's great. What's one story about a child that we have served that really stands out to you?
I can think of this one really resilient teenage girl. She went through so much trauma, parental substance use, domestic violence, incarceration, eventually ended up in foster care, and then came to Oakland Family Services. And, she said she was angry and she recognized that she had a bad attitude. And through therapy, she said that she really learned how to deal with all of those emotions, and her therapist made it fun. And now she's adopted, she's doing well in school, she has self-confidence, and she's really ready to start the rest of her life.
And I think those are the kind of stories that happen every day here that it's really great for people to hear about.
They are.
So I'm a mom and a lot of these mental health issues and suicide talk that makes me nervous. And I know you're a mom too. As a mom, why do you feel it's important that people support Oakland Family Services and what we're doing?
Well, I want my kids to be happy, healthy, compassionate people, to be able to do whatever career that they want. And if they need help in any area, I want to be able to take them somewhere like Oakland Family Services. And while we do accept almost all insurances, not everybody has insurance or very minimal, and we do have no cost and sliding scale options. And of course, we need help covering that. And so when people support us, we can help the kids build brighter futures.
Thank you so much, Debbie, for
Thank
sharing
you.
all this information with us today.